Hi from us here at Psychology Chartered. If you're watching this, there's a good chance that you're interested in learning more about what the term psychological assessment means. We know that for some people, the prospect of seeing a psychologist for assessment can sometimes cause uncertainty, confusion, or worse still, significant anxiety. Therefore, we hope that this vlog will serve to alleviate some of these issues. If your assessment follows an accident, illness or trauma, you could understandably have some apprehension about what assessment might involve, what's expected of you and what the implications of an assessment might be. The appointment might have been arranged by a solicitor and you may have attended other assessments with other healthcare and mental health professionals. All in all, this process can be daunting. Sometimes just having some information about the process can help, and so with this in mind we want to provide an outline for you and your family to hopefully reduce some of these uncertainties. We do appreciate though that this won't necessarily address all of your questions, so we'd certainly encourage you to get in touch if you still have questions or concerns that we don't cover. Sometimes people don't ask questions for fear of appearing silly, but we have over 20 years' experience in completing psychological assessments and reports for the courts, so it's likely that we're able to help you with the process. If the question or issue is important to you, then please do ask. So, first of all, let's deal with some terminology. It can be common to hear the terms psychological assessment, cognitive assessment and psychometric testing all used to explain why you're seeing a psychologist. These terms are often used interchangeably and will reflect what happens at the assessment. Another frequent question is what's the difference between a clinical psychologist and a clinical neuropsychologist? You'll be relieved to learn that the answer is a relatively straightforward one. A clinical neuropsychologist is a trained clinical psychologist who specialises in the assessment and treatment of neurological injury, illness or disorder. Neurological conditions can refer to diseases or injury to the brain and spinal cord. This is typically more specialist than the broader mental health work that's undertaken by many other clinical psychologists. So, why might you have been asked to attend an assessment with a neuropsychologist? There are two possibilities. Firstly, you might have experienced some obvious head injury or trauma, and as a consequence it's likely to be helpful to determine to what extent you've been affected. Secondly, it might be unclear whether or not your injury or illness has involved any neurological changes, and the purpose of the assessment might partly be to exclude this possibility. Many accidents, illnesses and events can be associated with broader psychological changes, all of which require assessment in order to further determine their nature, severity and whether treatment might be helpful. In almost all cases, psychological assessment will involve a clinical interview. This really just involves discussing your situation in order to find out more about you and your experiences. It might also include someone who knows you well, like a partner, a family member or carer. Many neuropsychologists will also include a cognitive assessment using psychometric tests. This is likely to involve tests that are specifically designed to gather information about your ability to remember information, process it efficiently, and to solve problems. You'll also typically be asked to complete some questionnaires which will provide your own views about various symptoms or problems. If you have any known problems with literacy or other specific learning difficulties, the neuropsychologist will find out more about these beforehand. And if you're watching this vlog and want to find out more about cognitive assessment, then please feel free to contact us using the email address at the bottom. A cognitive assessment can help to build a picture of your current abilities and how changes might impact your day-to-day life. This is also of use in legal cases where the court needs to understand any psychological changes in more detail. So what actually happens in a cognitive assessment? Typically, a cognitive assessment can last anywhere between 1 to 2.5 hours. Some practitioners may do this over a longer period or multiple appointments. Here at Psychology Chartered, a full neuropsychological assessment will typically last for around 4 hours, and that will include a clinical interview, psychometric assessment and some breaks. It's quite common that part of the reason people report feeling anxious before such an appointment is because they don't want to fail or feel stupid. We always like to remind people that information from these assessments can help to highlight areas you may need support or clarify things about your condition. It might help guide treatment recommendations or assist with diagnosis and planning for the future. Conversely, and whilst never a desired outcome, but should a person be unable to return to the level of independence they once enjoyed pre-trauma, a thorough cognitive assessment can help to provide some feedback as to why you may be behaving differently and ultimately help you and family members cope. It can also help other healthcare professionals and legal professions make decisions about how you're cared for and supported. So, here's a few tips and things to remember which we hope will make your assessment run smoothly and help to reduce your concerns. If you need to wear glasses, please remember to bring them along to your assessment. Bring along some photo ID, as this may be required in the case of some assessments for the courts. Often there's an opportunity for breaks, but we would always recommend checking with the psychologist before your appointment about whether or not you'll have time to have something to eat. If it's a long assessment and there isn't anywhere close by to purchase food, ask if it would be possible to bring along food with you. Here at Psychology Chartered, we supply water and tea and coffee. Regardless of how you think you may have performed, no one thinks you're stupid. If you prefer, just think of the assessments as a simple means to an end, which ultimately is there to help you to move forward with your life and adjust more effectively to changes and problems. We'd recommend coming along with somebody who knows you well, a partner or family member, as sometimes they can assist in providing information to the neuropsychologist. We understand, though, that it can be difficult to reflect on ourselves, and so having another person there can help to provide a broader perspective. If it isn't possible for another person to attend, the neuropsychologist might ask your permission to speak with them by phone in certain cases. Don't hesitate to contact the psychologist in advance of your meeting and ask any questions you may have if they've not been addressed beforehand by the person referring you. If you have a psychological assessment booked, regardless of whether it's with us here at Psychology Chartered or indeed another psychologist, and you're still feeling anxious, we'd be more than happy to attempt to answer any questions you may have. Do please email us at office@psychologychartered.co.uk or call the office on 02392 377 399 during our office hours, and we'll make sure one of our experienced team responds. Find us now on LinkedIn, Facebook and Twitter. I'd just like to take this opportunity to mention that lots of people we assess will afterwards communicate that it was nowhere near as bad as they'd anticipated. So hopefully, having had a chance to find out a little more about the process, you'll start to feel like this before you arrive for your own assessment. Thanks for watching.